Hello everyone, greetings from Bangalore Baptist Hospital. I'm Dr. Rupa KP, Consultant Emergency Physician, and here we are to discuss about CPR. Now, it is a process in the treatment of a patient or a victim whose heart has stopped working. It can be done by any non-medical person as long as you know when to do it and how to do it. Whenever a person's heart has stopped beating or heart has stopped is when you start off CPR. One is the person will be unconscious, not breathing and not having a pulse. Now when these three things are present, the patient or the person is in cardiac arrest, and that's when we start off chest compressions, which is the major component of cardiopulmonary resuscitation or CPR. If a victim collapses in front of you, first and foremost you need to identify whether the person's heart has stopped breathing or is he in cardiac arrest. For that, we need to check whether the person is conscious or not. You gently but firmly tap on the shoulders and ask, "Sir, are you okay? Are you okay?" If the person is not responding or is unconscious, next you check for breathing. We check by looking at the movements of the chest. If there is no movements of the chest, that means that the person is not breathing. You do this for about 10 seconds. Always make sure that the person or the victim is made to lie flat on his back on a firm hard surface. Next, you place yourself onto any side of the victim, and then you will have to kneel down if the person is on the floor, and then you make sure that you start off chest compressions as soon as possible. You place this part of your hand just on the center of the chest between the nipples, and then interlock the other hand with this hand just like as I've shown. Then you make sure that your wrist, your elbow and your shoulder are all in one line. So once you have ensured that, you lean in forward almost onto the victim's body and then start chest compressions like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So ideally we have to continue chest compressions for 2 minutes straight. Unless you get exhausted before that, then someone else can take over. At the end of 2 minutes, someone else will take over the chest compressions, and you can reassess the victim whether he or she is breathing or is there a pulse back or they regain consciousness. So this 2-minute cycle continues as long as the medical team arrives or you get exhausted. So this is the technique of chest compressions that can be delivered by anyone during CPR.